So I got my test results. The DNA came back negative, which is fantastic, which means I don't have genetic markers for any cancer or the cancers they tested for. And so this is just my body making all this fun stuff, and it's not coming directly from my parents, I guess, although my hope was that I could blame somebody. So, nope, it's just me and all my fun medical problems since I was a kid. The oncotype score came back as well, which the oncotype ranges between 0 and 100, level of severity, pretty basic. My oncotype is 14 right now, which means as it stands, I don't need chemotherapy. Yes, I'm happy about that. Every time I think about that, I just hug my hair. Yay! So that is good. 14 means that my cancer is not aggressive enough at this point to... I would get less than a 1% benefit. Like it has to do with your reoccurrence percentage and score. So basically, if I had chemotherapy, it would only reduce my rate of recurrence by less than 1%. Chemotherapy would basically do more harm than good. So that's amazing right now. Keep in mind that as much as I want to get excited about any of the good news, that this is just initial pathology. Once they do surgery and they do the pathology on what they actually take out of your body and do testing on, the pathology can change, and it very often does. Women that were told that they were a stage 1 and all of a sudden they're determined that it's a completely different cancer and they're stage 3, or I mean a number of things can happen. According to my MRIs, they didn't see anything wrong with my tailbone, so that's which is hopefully good news too, but I still have to look into that with a completely different doctor. They did ironically see a bunch of things wrong with my uterus, so I have to see a gynecological oncologist, which is so fun to say. And so that should be a good time. Probably rare that anything going on down there would be cancer, because that would be considered a secondary cancer, not the breast cancer spreading. So I really don't think that's what's going on. I have endometriosis. I've always had various problems with my uterus, and that is genetic. Both my mother and grandmother always had serious problems. So we'll see what happens with that. What the MRI did show on my breast scan was that the tumor is in fact bigger than they had initially thought it was, and it's closer to 2 centimeters. They also saw a couple other spots and masses in my breast that they think are benign. So yeah. Then the doctor, upon seeing the test results, before I ever went and talked to him, before he discussed the test results with me or anything, he submitted a plan of treatment to my insurance to be approved without my consent and without discussing it with me. He just automatically went, oh, this is the surgery and treatment we should do, and he submitted it. Which, I gotta say, made me really angry. It's my body, and he submitted a treatment plan that I didn't want. That concerns me with what the insurance will think in changing it. That concerns me that I wasn't even considered in the discussion of what I want done with my body. he's supposed to be a very good surgeon, so I trust him in that respect. I'm just really tired of doctors essentially manhandling me and treating me as if I'm on an assembly line. Oh, well, this is very easy and clear, we'll just do this, etc., and on with their day. So when I did go in to see him, I know he probably wasn't very happy with the fact that I kept him there for 30 to 40 minutes and having a conversation with him. And at this point, it's not so much you going in and having questions for your doctor. It's more of a, you need to do all this research to advocate for yourself, know what the answers to the questions are when you go in and ask them, just to see what they say, to see if you agree with them, to see if it doesn't line up with the research that you did, and see how you feel about trusting this person to do surgery on you. So for me, it is less of a list of questions now to ask the doctor as it is these are the topics of conversation that we need to address. So that's how I went in and I had the conversation with him, and it basically boiled down to now I'm not a big-breasted woman. I'm not an A cup, but I'm not a large-breasted woman, and the amount of tissue that they would have to take out now would be around 4 centimeters, which would be around a quarter of my breast. He still wanted to do a partial mastectomy and radiation. I'm not okay with that. I don't want, and he had admitted when I asked him that yes, I would be noticeably asymmetrical. I'm already a little asymmetrical, as a lot of women are, and the cancer is in my smaller breast, and now taking that much tissue out, I would be very noticeably asymmetrical. It's not only that, it's all the research I did on the side effects of radiation. It can be very dangerous. I'm a professional photographer, and there's a lot of risk concerning the kind of things that can go wrong or how your body can react to radiation, and I'll do a separate video just on radiation and other treatments and the side effects of those. But basically, it increases your risk for fibrosis. The chance of fibrosis is like 50% chance, so most women get it. It can shrink your breast further. It can cause nerve damage and nerve problems, and this is also the arm when I'm doing photography that I have to hold my arm in the air like this. And they'll also be removing lymph nodes, between 1 and 3 lymph nodes here. So I won't be able to lift my arm up for a while. I'll have to have a lymphedema specialist, which is a condition that can develop as a result of removing lymph nodes and it disrupting your lymphatic system and drainage. And it can cause severe pain, numbness, tingling, reduced range of motion. These are all really big concerns for me. Even best case scenario, if I am really a stage 1, fantastic. But it's not like, oh, they chop it out and they take it out and then you're good to go. You have to live with the side effects and the medication they try to put you on, which has horrible side effects. And every woman I've spoken to says that they have long-term side effects from just having the lymph nodes removed. Whether that's minor, whether that's major. I have opted to have a double mastectomy. I want to have matching breasts. That I don't want. Radiation can cause one to kind of shrivel up and freeze in time while the other one ages over time, and I'm not comfortable with that. So I want to avoid radiation and possible side effects of that if I can. Now, again, pathology can always come back on that and say that, oh crap, well, you have cancer in your lymph nodes, which then would require radiation regardless, which would suck. Basically, that's where we're at, and I have to now. The doctor doesn't agree with my decision of having a double mastectomy. He's not thrilled with that, but he knows it's my body. He's willing to do it. Now we're waiting for the insurance to see what the insurance says, and I'm waiting to be referred to a plastic surgeon. So I will likely be having 2 consults with 2 different plastic surgeons to see what the course of action is. I'm going to do another video and address what exactly will happen to my breasts and how this is supposed to work. I'm sure I'll get more info after I meet with the plastic surgeons. And I'll also address the side effects of radiation and such, and operation stuff, and radiation stuff, and me being incredibly awkward in front of the camera still. I'm sorry.